Hello, class. Today we will start with our chapter of public health, and this would be chapter one. And I will introduce you um, to this chapter. So let's start. A good health system delivers quality service to all people when and wherever they need them. So this we will study about health system and healthcare system in this chapter, and you will become aware how health is important and why we should uh, deliver healthcare to people. Every nation has its own healthcare system. No two are exactly the same. It varies from country to country and nation to nation. In all cases, it requires a robust financing mechanism, well-trained and adequately paid workforce, reliable information system to base policies and decisions, well-maintained facilities and logistics to deliver quality medicines and technologies. As you know, the technology and there's an advancement in research. So every time there is new stuff coming up, and we need to update ourselves, keep our knowledge up to date so we can deliver in a nice manner. Health is a state of complete physical, mental, and social well being, and not merely absence of disease or infirmity. The determinants of health include genetic inheritance, physical environment, social environment. Now there's so many things in social environment like economic stability, neighborhood and physical environment, education, food, community and social context, healthcare system, and then comes socioeconomic status, race, ethnicity, occupational health, social interaction, social networks, and social support. Health behavior, how you think health and how you have your ideas about health, eating habits, or education, mental health, physical health, or holistic health. There's a new subject also. So healthcare system, it deals with primary, secondary, and tertiary care or prevention. There are six components of US healthcare system: the facilities, workforce, medical, and the products, all kind of products comes in medical, leadership and governance, financing mechanism, information system for performance evaluation. This is all you as healthcare system involves. So there's more explanation about the social determinants of health. This figure 1.1 shows that what comes under economic stability, like your employment, your income, expenses, debt, medical bills, support. Then the neighborhood and physical environment, housing, transportation, safety, parks, playground. Do we have a place like a walkability? Can you walk? What's your zip code where you live? What's the geographical location? Education, what's the level of literacy? What kind of language you speak? Early childhood education. Maybe you're somewhere else in the world and you have your early childhood education somewhere else. Vocational training, higher education. Maybe you are skilled, you have some special skill. Food and hunger, excess of healthy options come under food, community and social context, social interaction, support system, community engagement, discrimination, stress. This all comes community and social context. Healthcare system, health coverage provider, availability provider, linguistic and cultural competency, quality of care, and this all combines and give you health outcomes, and health outcomes in turn decides the mortality, morbidity, life expectancy, healthcare expenditure, your health status, functional limitations. So these are all interrelated. What are the healthcare determinants? We will study about healthcare and its determinants, like what determines the healthcare system or healthcare. The first question is, what is healthcare? care can be categorized in terms of its relationship to prevention, primary, secondary, and tertiary. Primary prevention is concerned with eliminating risk factors for a disease. Secondary prevention focuses on early detection and treatment of disease, like subclinical or clinical. Subclinical means that it's not clinically visible, but you have the disease. Like some people have, if you undergo some test, the test shows that this person is prone to some diseases, but it's not showing clinically. Sometimes you have anemia and it's not showing clinically, but your blood count is low when the tests are done. Tertiary prevention attempts to eliminate or moderate disability associated with advanced diseases. Population survey. America is the third largest country in the world, following India and China, both of which population exceeding 1 million. There is a steady increase in population throughout from 20th to 21st century. There is a heterogeneous population racially and ethnically. As you know, the diversity is more in USA now. In 2020, 58.9% of population was Hispanic, whites 19.1% were Hispanic or Latino, 13.6% were Black or African American, 6.3% were Asian, 1.3% American Indian or Alaskan Native, and 33% were some other race or two or more races. This diversity is also seen in languages spoken. There are a lot of languages spoken in USA now. And about 22% of households speaks other than English languages in USA. And these all the information is not made up. This is through research, US Census Bureau, Foss and Fine, who did their research and wrote a paper. And this all comes through evidence-based research, which is very common in USA. And these are the figures, the facts and figures. Age structure. Age structure also affects US health system and it is changing. Population that is 0 to 4 years old is decreasing from 6.5% in 2010 to 5.7% in 2021. Similarly, 5 to 19 years old decreased slightly, but the population 65 years and older increased from 13.1% in 2010 to 16.8% in 2021. Hence, physicians are catering more for older adults now than for the younger ones. Socioeconomic status. Poverty also affects adversely the ability to access healthcare, health behavior, health conditions, and length of life. The national poverty rate was 12.8% in 2021, but significantly different for nation's oldest and youngest population. So this is, let me correct this 12.8%. The child poverty rate was 16.9% in 2021, 14.2% percentage point higher than the national rate, while poverty for those aged 65 and over was 10.3% and 2.5 percentage point lower than the national rate. So these are all the figures, and it shows that how child uh, age, uh, uh, the people who are in their childhood, they are facing more poverty than the people who are above 65 years of age. So mortality, there were 3.5 million deaths in the United States in 2021, mostly among people 65 years and older, 72%, among 45 to 64 years, 20%, and small percentage for less age. In 2021, infant and child death rate decreased from 558.8 per 100,000 to 25 per 100,000. So these are like they have more child safety and child survival medication or modalities were available to save little kids or infants or children between the ages of 1 to 4 years old. and 14.3 per 100,000 for 5 to 14 years old child. So look at, there's a drastic change. There is 558 and now it's decreased to 14.3. So this is the mortality, and this is how we gauge the mortality rate. There are some figures that would show that how different ages have different diseases and what is like their mortality rate. So this figure is showing percentage distribution of the 10 leading causes of death by age group. Like, in the ages 1 and 9 years old, nobody's dying from cancer, nobody's dying from unintentional injuries, no other diseases, but cancer, stroke is very less, septicemia, CLRD, influenza, pneumonia, which is very common in younger people, heart diseases, some infants are born with heart diseases, homicide, and congenital malformities. It takes the wider aspect of this pie chart. So, most of the children, it means that they are dying of either somebody killed them or they have some congenital malformities. As compared to the people who are up in the age and then they have some chronic debilitating diseases. Like if we look at age 45 to 64, um, they are most of the time dying from unintentional injuries, and then comes chronic liver disease and cirrhosis, and diabetes, stroke, suicide, and less of the kidney disease and septicemia and rest of the stuff. So as we move high, we will see, different diseases in different age group, like in ages 85 and over. They are suffering from Alzheimer's disease, stroke, CLRD. Unintentional injuries are very less because they become safer. Kidney disease, influenza and pneumonia, hypertension, diabetes, and unintentional injuries include falls, which is very common in 85 years and over, and this is 2.7, which is a considerable, a good number. So I apologize, I was not looking at this figure, and this is like a, you can see how different ages have different diseases and different outcomes of, like, how they die and what is the cause of their death. Similarly, this is another figure which is showing that how people in the United States between 2020 and 2021, the highest mortality rate is due to heart disease, cancer, and COVID-19, obviously, then unintentional injuries, and then comes stroke, chronic lower respiratory disease, Alzheimer's, diabetes, chronic liver disease, cirrhosis, and kidney disease. And similarly, this is like age adjusted death rate, which is like in a diagram, in a histogram, is showing the death rate by race, ethnicity, and sex. Like Hispanic males, what is the percentage that they die, non-Hispanic males, and this is all they have, like black male, black females. So this is also the mortality rate. Mortality rate is always the number and per 100,000 US standard population or whatever the country is. So this is showing how which of the race or ethnicity face more death, and it's in the USA. So, healthcare system performance and information technology. Every healthcare system is evaluated in some way to see whether it is meeting its mission. We use a criteria developed by Ade and colleagues. They conceptualize in 1993 to 2004 the evaluation criteria for healthcare system performance as quality of healthcare, equity of healthcare, efficiency of healthcare. So, quality of healthcare, it is assessed by the healthcare outcome. It is done by research which compares the clinical outcome of provider, institution, treatment, and procedure, and they translate these findings into clinical guidelines. What comes under equity of healthcare? That everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and other consequences which hinders them to access healthcare, like including powerlessness and lack of access to good jobs with fair pay because it is expensive, good healthcare. Quality education, if they're not educated, how would they know that what kind of disease they have and how would they take care of them? And housing and safe environment and healthcare. So efficiency has been divided into like it is either allocative or productive. Allocative is attaining the most valued mix of healthcare services, or productive is producing a given level of healthcare services at minimum cost. So the next point comes an allocative issue is how much to invest in preventive versus curative medical services. So more of the prevention is thought here rather than treating it or curing it. Whereas productive efficiency issue might concern whether and where to substantiate relatively low cost nurses position in the provision of medical care. And this is like more on the care side. Healthcare performance may be assessed at the micro level for physician practice, hospitals, or other healthcare setting, or at the macro level for regions, states, and nations. At the macro level, efficiency is assessed using production function, cost effective, cost benefit, and cost utility analysis. At the macro level, efficiency analysis is based on comparison of the performance of healthcare system, types of healthcare services provided, primary care, personal and preventive treatments or managements. Secondary is like secondary and tertiary care involves services available at the physician office or at the hospital. And this would include surgical procedure, diagnostic procedures, any treatment, any interventions, or treatment interventions. In USA, both these are highly developed services. And this is true that USA has the most highly developed services of all these primary and secondary care. Challenges of healthcare delivery and health policy. The importance of good health to American life. The American nation is built on the idea and society ensuring life, liberty, and pursuit of happiness. These words are from the second sentence of US Declaration of Independence. Health is among the core needs to live a vibrant, viable life. Good health is essential to participate in political, social, and personal achievement of our various goals. Good health is necessary to support ourselves and our families, plus to pursue happiness and a good life overall. Our nation has invested a tremendous amount to learn how to keep people healthy and how to restore health when disease, injury, or illness occurs. In 19th century, researchers and public health experts from the United States and other countries began to understand the role of germs in contributing to diseases and the importance of basic public health practices. Clean water and sanitation. In 20th century, the science of art and medicine explode, creating knowledge to treat people with disease and injury or illness. Latest example is a fast development of COVID-19 vaccine, and we have witnessed it. So this is a little bit history that they are telling you. The new ideas for better treatment and rehabilitation is still in the pipeline to restore health when Americans face life-threatening disease or medical problems. As we know that American as a nation, they are always striving for the best, always, and there is a room for improvement all the time. And this is good. Like, the more you think and the more you put in new ideas, or the better treatment and rehabilitation modalities, the healthcare system will become better. To understand the health system, in addition to practice healthcare, we need to understand the economics, organizational, and management side of healthcare. And this is very important because you will be working in a healthcare system. So you should understand the economics, how it is organized in a hospital or in an agency or in an organization or corporation, and also the management side of the healthcare, how we manage it. So COVID-19 pandemic is a good example how technology advancement help us to control it because it was like an emergency. Although US hospitals and their organizations or agencies are very well equipped, but still COVID-19 pandemic has made them realize that there are some drawbacks and we need to cover it, and that's how they learn, and that's how they have become more robust and more educated about their weaknesses, and it is very good. So they will work on it, and they will become expert in handling emergency infectious disease pandemics. Just under 20% of the economic resources are spent on medical care and health promotion. Full 11% of all jobs in America are in the healthcare sector. Each of us spend almost a sizable share of our income on healthcare we need. This money is spent through our taxes, foregone wages, used by our employers to pay health insurance, and by our out of pocket healthcare expenditure. So this is they are trying to make you understand the economic side of it. Defining characteristic of the U.S. health system. Healthcare system is not organized as a single enterprise, single organization. Most of the people who are coming from outside the U.S. they have seen hospitals and single organizations doing their job in a boundary, like, only they are the masters over there. But the healthcare system is different in the USA. It involves many types of actors and organizations working independently and with little coordination to contribute to healthcare improvement in a systematic way. In other words, they are all interrelated one way or the other, maybe little, maybe somewhere more. Health is determined not just by medical care sector but by social determinants of health. And we know that we have just shown you a slide which include income, education, housing, social services, health behavior, and many other factors that even have a larger impact on health than services received. Lately, we have realized that health maintenance and restoring health to a person who has medical problem is very important. So this is another important point, health maintenance. So often the medical care system takes charge of caring people to alleviate symptoms of a medical problem. Or the goal is to limit the spread of a medical problem or to help a person to cope with the suffering and loss of function when major medical problems emerge. So what they are trying to make you understand that no matter what and how that person has faced the problem, we will, or the healthcare provider will do maximum to maintain the health of that individual. Various and different actors in the healthcare system play their role: doctors, nurses, nursing assistants, various technicians, hospitals, nursing homes, rehabilitation center, pharmaceutical, com- which companies, medical device companies, and home care, nursing are among the actors who engage and put their effort for people with medical needs. So, see how many institutions or how many different organizations or agencies are involved. Uh, this is only in USA that they all collaborate, they all are interrelated, and all talk to each other one way or the other. They help to achieve person health one way or the other. If the person is medically sick, they will treat him. If the person is physically harmed, they will try to make that person live with that disability, or try to alleviate his pain or suffering and maintain the health of that individual. This is the main idea. Health maintenance involves doctors and other activities like screening, preventive services, and this can help people not to fall sick or detect illness ahead of preventive treatment. So this is another thing, that they have a screening system which has also come into being. Let me say like this, that this is also introduced because there are some diseases which through screening we can detect it earlier than the disease attack a person. So this is all requires vibrant public health and social system that works to help people avoiding illnesses. Public health includes preventing and responding to epidemics, make sure food, water, and sanitation are safe, monitoring environmental toxins, and developing community-based public awareness, for example, education initiatives to help people consume healthy food, do their exercises, avoid unhealthy behavior like smoking, drinking too much alcohol, or drinking alcohol in excess, using recreational drugs, or abusing prescription drugs. Population health has also worked in its way into health system. We recognize that health of population is determined by social and economic factors. For example, educate family income, high quality education, and social connection. So this is all population health. You must think and broaden your horizon. We will address both the challenges in this course, like keeping the population healthy and providing effective medical care when required. Following are other key factors defining U.S. healthcare system for this course: the importance of organization in delivering care. These include hospital, nursing, homes, community health centers, physician practices, social services agencies, and public health departments. So these are like included in the healthcare system. The role of professionals in running our system. So what are these professionals? These are physicians, nurses, managers, policy advocates, policymakers, researchers, technicians, and those directing technology and pharmaceutical businesses. The emergence of new technology, big data, and new pharmaceuticals. So, new techniques in imaging, mobile apps, big data, machine learning, pharmaceuticals, surgical procedures, DNA technologies, and others are remarkable but often expensive ways of improving healthcare. Obviously, all of these require uh, money to buy and to use them also. Increasing role of other players, including business organizations, technology companies, and investment. Increasingly, other parties outside the traditional healthcare sectors are also becoming large players in the healthcare system, including the private equities. Tension between the free market and the governmental control. The tension shapes America's culture and is sharply present in healthcare sector. Americans have diverse opinion about whether a person thinks delivery of healthcare should be done by non-profit or for-profit organization, or whether healthcare should be financed by taxes or private payment. COVID-19 pandemic reflects this trend. So, like in countries, most of the time, government is controlling the healthcare. It's all government. Some free medicines are given in the dispensaries. Some doctors look after you freely, or do their outpatient free. They are government hospitals. And in America, it's a little bit different. Um this as a country where there are independent private sectors too, which can take care of you very well. And this is always a debate here because this like a money market. It has become like a business. So the tension is still there, and the discussions are still on. A dysfunctional payment system. The traditional way we have paid healthcare providers reward them for providing more and more billable services rather than rewarding them for being efficient in delivering effective care. This free for service system over the years has been some incremental changes with more frequent use of payment approaches that reward keeping people healthy or providing services of higher value. We need to set goals for customer or patient friendly environment, delivery of high value service. Somebody is paying you, then it has to be a high value service, some quality service, and sometimes cost-effective, efficient, logical provider services, and to make payment approach more transparent. Most of the time, patient doesn't know what he's paying for. All of these above defining characteristics make healthcare delivery a challenging part of US politics and economy. Major issues and concerns. Improving quality. Many annual deaths due to medical errors are avoidable. Many people with debilitating disease, mental health issues, diabetes, asthma, or substance abuse problems receive care which is effective only about half the time. The system is not always customer friendly and has not adopted many practices routinely used in other sectors to improve customer experience. So patients is like, they have a lot of complaints like avoidable deaths. People say that we are paying too much and the quality is not good, the service is not good. So there's a good base of knowledge to organize and deliver high quality care and service virtually all the time. So they have come up with an idea to deliver care and service virtually. The person can access the app or the service when the person is ready mentally, or when the person has time, or when the patient is willing to do some healthcare changes in his life. The challenge is spreading this knowledge into practice across the nation. And the second major issue is improving access and coverage. Millions of Americans still lack insurance coverage, and millions more have inadequate coverage for acute care. Like some of the insurance companies would say, we don't cover if you have diabetes or if you have cancer, so we are not going to cover your these diseases. And sometimes Americans they earn so little that they cannot afford to have insurance. The Federal Health Reform, the Patient Protection and Affordable Care Act (ACA), Obamacare, has dramatically reduced the number of people who lack insurance coverage because they have given insurance to those people and was shown to be very important during COVID-19 pandemic. Though gaps in coverage persist, there's some shortcomings in the insurance, like they will cover something and they will not cover some few of the things, some drugs even. So this is like there are some shortcomings, there are some gaps, but most of the people are covered now through Obamacare. Sorry, class, I was just sipping of the water. Many states, though a decreasing number, have chosen not to adopt some of the expansion for low-income residents because of political opposition. Even when Americans have insurance coverage, access to healthcare is not always ensured. Many rural areas have shortage of doctors and other providers, and many doctors refuse to see patients with certain type of insurance, generally coverage for low-income resident or medical coverage because of low payment plans. So see, these are the shortcomings. Even if you have insurance, either the doctor is not there, or the specialized doctor is not there, or you're paying insurance company is such a low payment that they won't cover certain of your test or your medication or doctor's fee or stuff like that. Slowing the growth of healthcare expenditure. Healthcare expenditure are simply the price of services multiplied by the volume or number of services. Total expenditure are growing much more rapidly than the rest of the economy because both prices and volumes of services have increased relentlessly over the past 50 years. To keep healthcare affordable for middle class and low income residents as well as for taxpayers and employees, We need to devise ways to moderate the ever increasing share of our nation's economy devoted to the health sector. The challenge is to determine how to restructure delivery and payment as focus is diverted to high value care and high efficiency standards. There has been progress in bringing down the healthcare cost down to Great Recession started around 2008. Encouraging healthy behavior. Healthy behavior encourages people to avoid diseases and injuries and to prevent diseases or injuries from getting worse or even getting an injury or a disease. We should have healthy preventive behavior. And it's not difficult. It's just like your thinking. It's in your thinking. If you think you're going to avoid something, you will, and you will learn. You you will be more um, anxious and robust to learn different things, how to prevent all these diseases or injuries. Like people read books, and obviously now there is an internet. People read on the internet. For millions of Americans, living healthy lives is not the highest priority due to other more pressing things. They have other things uh, like their job, their lives, their um, other responsibilities or other priorities which are more pressing factors in their lives. Changing health related behavior is a difficult challenge. Also, we need to find effective preventive program. This is a battle that extends well outside the traditional healthcare sector, improving the public health system. So now we come to improving the public health system. The governmental public health infrastructure maintains population health and regulates aspects of the healthcare delivery system. State and local health departments monitor the health of residents, provide wide range of preventive services, and regulate healthcare providers and businesses such as restaurants that affect population health. The effectiveness and funding of state, municipal, and county health departments they vary widely. They are all tested during COVID-19 pandemic with gaps and shortcomings. I have mentioned this before that all these uh, truly tested that how in emergency and how we think that we are so expert and how this has killed so many people. There are some things which we do not know. Improving the coordination, transparency, and accountability of medical care. Problems of quality, cost, and access are caused by fragmentation and lack of coordination at the community level. So we can say that where does the quality and cost and access is not up to the mark. Mostly it's at the community level. This fragmentation exists both within and between healthcare organizations. It is affected by a lack of integrated electronic record system and by a lack of cooperative relationships among different types of providers who treat the same patient. For example, primary care physicians, hospitals, and specialty physicians often fail to work as teams or in coordinated ways. Most of the time, consumers are not given all the information they deserve to make adequate medical choices. Providers often change prices or refuse to reveal prices they will charge the patients. Second opinions are not encouraged as frequently as they should be, and patients often do not get clear explanations of treatment options or the pros and cons of the options. Next is addressing inequalities in access and outcomes. In the United States, medical care's associated outcomes depend on one's income level. Obviously, how much you earn, what's your race, what's your geographical location. Moreover, studies demonstrate that access and outcome also vary by race. Are you black, Latino, or whites who have the same income and education? Maybe you think differently. So, marked differences also exist in access, quality, and outcomes across different regions of the world. It is all who have the access to what level and what quality they demand, and also how their body react to the outcomes or how they think the outcomes. Somebody is satisfied, somebody is not. So, addressing these inequalities is a major challenge faced by healthcare sectors. So, but it is obvious they should make a point of it, but uh, obviously it's going to be a challenge. because everyone is different, there is diversity, and we should accept it and we should work according to it. Contending with an aging population. US population is rapidly aging, or many people are aging at the same time. Older adults use much more healthcare than others. Obviously, they need help. Their body is aging, and they need more health and care and attention. So, aging population put pressure on the delivery of financial or medical care and long-term care. Trust in the health and public health system. COVID-19 pandemic has made it clear that people often they do not trust key components of the health and public health system. Probably because the infection was spreading too fast, or the deaths, there's a huge number of deaths of people. So they kind of lost their trust. This remains an ongoing challenge for our system. Obviously, no system is perfect. There's always some limitations. So, key stakeholders influencing the health system. The stakeholders define how something in the society is done. It is a group of important people who have power, interest, and care for the relevant community or society. Different stakeholders may have different goals and view what should be done and how it should be done. To understand the health system, one needs a good scorecard of the interest and roles of the stakeholder group. The stakeholder in the health system include five key groups. One is consumer, then comes provider, then comes employers, insurers, and public policymakers. So let's talk about individuals. Individuals consumer must be center of the health system. After all, it is their needs, the individual's needs, or the patient's needs, or the person who needs healthcare. It's their needs, but they act as bystanders in healthcare decisions because physicians are making the decisions, or other providers are making the decisions, because they know the best, and they fail to have a patient co-manage a medical problem or be a full partner in selecting the choice of action. So, patient or the receiver is really a bystander, making other people think that they can decide for them. So, or perhaps an insurer decides what is the best or allowed given a specific health condition. So then comes the insurance company, and they also think that they have the power to decide. Individuals are bystanders also when payments are concerned. Providers think it is the insurance company who is their customer because insurer pays much of the bill. So there's like confusion. Either insurance pays or the individual pays, or the individuals are just because they bought insurance, so they think that they will be covered with a lot of stuff. But in reality, as the previous slide said, there's some shortcomings. So obviously, the individual is confused. In addition, some provider may charge differently to different groups and individuals. So every healthcare provider has their own charge. The usual norm in our country is that the person receiving the service should be aware of the charges before purchasing the goods. In USA, you have to know what's the cost of your the service you are getting. When there is widespread dissatisfaction, a lot of individuals or patients they get dissatisfied, and who are infringing stakeholders too. So they complain, and then the change happens. In the 1990s, due to complaints, insurers changed their rules of early managed healthcare status, choosing healthy choices like eat healthy food, stay physically active, drink alcohol moderately, abstain from tobacco, and regular doctor's well checkup, like you have a yearly well checkup. And all these things, if you do, you might not need a doctor, or when you are healthy, you don't go to doctor that. So hence individuals want good access to healthcare system for themselves and their families. But there has to be someone to tell them to do all these things or to take all these steps to stay healthy. Suppose indicate individuals want affordable, good quality healthcare system. They would like to get treated by providers who are expert and cater to their needs in an experienced manner. So this is their demand, and that's why the healthcare system is becoming more wide, including people like us who are health education promotion specialists who would help people to decide what to do or to make them understand how they can take care of their health. So, in other words, the healthcare industry is widening itself in USA. So, providers and other professionals engaged in making the health system operate. Excuse me, class. The majority of the workforce in healthcare field is motivated principally by the social goal of keeping people healthy. Medical providers, caregivers, pharmaceutical and medical device or technology companies, and researchers have created an impressive set of interventions that can help people who are sick. More and more physicians and other providers are working in large practices compared with the small ones now. Hospitals are merging with other types of professionals inside and outside the health system and are engaged to improve health. So employers are the stakeholders, but most businesses often employ private health insurance as a key element of their compensation package. And this is another way to attract employees. The cost of health insurance is the cost of doing business for employees and can greatly affect the profitability of a business. Employees want to see a slowdown in their healthcare cost responsibility. Employees want healthy employees who are productive and do not take time off from work due to illnesses. These desires lead some employees to advocate for high quality healthcare, for wellness and prevention programs that can help employees stay healthy. Just to give you an idea, these are the uh, employers or these are the people or organizations who will hire you as a health education promotion specialist, as we have read in our or in our previous courses that there are organizations who hire these people so they can cater their employees and help them. So insurance company act as an intermediary among payers, often employers, providers who need a system for getting paid and consumers. In some cases, insurer takes some financial risk if the payments they make to providers exceed the premiums set for employers, the insurer loses money. The insurer leaves the employer to bear the risk and plays the role of a pure intermediary, setting rules to determine what payment is made. So these are actually what insurers do. The insurer must negotiate these values with employers and providers. As a stakeholder, insurer always feel pressurized. Employers, consumers, and providers often have relationship with insurance, who in many ways play the role of referees in healthcare. Payers often feel that the cost of running the insurance process are too expensive because they're just paying them every month, and they think that if they're paying them with every bit of their check or a good amount of their pay, so they should take their side and not tell them what to do. So payers, like a patient or individual, they always feel that they are paying too much money. Some health systems are starting their own insurance companies, and it is possible that capitated payment system, premium payment for a family person for the year regardless of use of covered benefits, could bypass traditional insurance system and go directly from payers to providers. Insurers want to protect their role. They also seek to expand their role by offering analytical services or care management programs that can support high quality and more efficient delivery approaches. So, in other words, insurer has a lot of responsibility. Two, public policymakers, both public officials and elected politicians are included in this category. So we have to make some policies for the public. So that's why all these elected politicians and public officials, they are included in to make public policy for the community. Both often have conflicts. Obviously, people talk, they have conflicts, they argue, then they come to a point. So often have conflicts that how the health system should work and what role government should play in healthcare. Differences are in the ideologies and viewing different management techniques or different management modalities. So, viewing different management to this extensive responsibilities for healthcare in the community. Some consensus does exist on policy issues within this stakeholder group. Most elected officials and civil servants would like to see a slower inflation rates in the healthcare sector. Additionally, consensus shifts to take sides of US health system to be a state-of-the-art medical care and prevention interventions. So they want the best. They want to reach the best or state-of-the-art medical care. Finally, the common senses sense that quality and patient care experience should be the most important concern of the healthcare provider. If they are satisfied, if your customer, your patient, or the person you are working for satisfied, or the patient experienced a very good quality healthcare delivered to that person, so they are satisfied, and that is the most important concern of the healthcare provider. So let's talk about a little bit about COVID-19 and the US healthcare system. Late in 2019, a new coronavirus, officially named SARS-CoV-2 and referred to as COVID-19, emerged in the central China. In subsequent months, COVID-19 resulted in illness, deaths, and economic calamity worldwide. On January 30th, 2020, the coronavirus has spread rapidly, killing more than 40,000 people and sickening more than 7 million worldwide. The pandemic in US state can be roughly divided into four periods: pre-vaccine, which is 2020, then vaccine availability, that is 2010, sorry, 2021, and then Omicron and normalcy. So normalcy is after 2021 and up till now, it's like normalcy period. Uh, So COVID-19 impacted every component, stressing every weakness the system had previously harbored, as well as exposing one's previously letting know. So this COVID-19 has exposed the shortcomings of the healthcare system more openly. In the US healthcare system, so we have to think that is the US healthcare system a good system? The US health system is changing rapidly in financing, organization, treatments, and administration. Are these changes leading to better outcomes of patient and value for payer? These are the questions that they are asking themselves. They are asking why? Because they want to be better. So they want to know how much people trust, how they think about their healthcare system, and amount of money they spend. Is it worth it? So if healthcare leaders expect to reap benefits from their growth, their organization must become actual system of care. This will require that the enterprise at least do the following. What? Be an operating company, not a holding company. They should be operating, they should be coming up with something. There should be some positive outcomes. Merely owning asset means nothing to patient and their families. Obviously, you should be able to deliver. At its core, be a clinical enterprise. The core of a health system should be a sentient clinical entity governed by the clinician themselves. System logistics and financial support. Obviously, all these clinicians they need support. Provide patient and families with a seamless and consistent experience across the system. Instead of that, families and the patient they complain, you have to provide them with a consistent um, quality system that they appreciate. The healthcare system may have many various care sites, but patient and families should receive a consistently high quality clinical experience regardless of who they are or where or how they enter the care system. Affirmative control in the delivery of care. Affirmative control or actively managing the cost of care is impossible without timely and accurate information at the point of care. Consensus among clinicians about what the practices are and consistent collaboration inside the care team to achieve. So these are the changes and these are the basic points which needs to be catered. All this information is gathered from all these resources, the references, and here this is the last slide. So if you have any questions, class, please ask me. Do not hesitate, and thank you.